When it comes to methylene blue, the most important variable isn't whether or not someone takes it, it's how it's used. Because this is one of those compounds where context matters more than almost anything else when we talk about dosing strategies. And a lot of the confusion around it comes from people collapsing very different use cases into a single conversation. You'll see ranges and protocols and strong opinions along the way, but they're often pulled from completely different settings and applied as if they mean the same thing for everyone. I'm Dr. Kenny, root cause health detective and IFM certified functional medicine practitioner, and my goal here isn't to give you a protocol. It's to help you understand how to think about dosing and safety in a way that actually respects how this compound behaves in each person's unique body. So we'll walk through what factors actually matter and what tends to influence how people respond to methylene blue and where oversimplification and black and white thinking can create problems. All right, so let's start where the confusion usually begins. If you search methylene blue dosing in a Google search, you're probably going to run into a range that looks something like 0.5 to 4 milligrams per kilogram of body weight. That's what gets used in emergency room settings for things like cyanide poisoning, for instance. What sometimes happens is people see that range and they do the math for their own body weight and start to apply that logic to the capsular or oral forms that are ordered online. And that's a big error, not because their math is wrong in any way, but because the context is completely different when we talk about oral versus IV routes. And it enters the bloodstream at its full concentration in a controlled clinical setting. When you take an oral dose of methylene blue for any of the longevity or mitochondrial focused uses, it has to transit the entire digestive tract. Some of it gets absorbed, and the absorption rate in the gut is actually quite high at about 80 to 90% for most people, if their gut is functioning well. It's a fundamentally different experience for your entire system. The context of the delivery still changes everything about how the compound behaves, and that's very important to remember. So beyond just the dose size and the route, there's another issue to consider with dosing strategies, like caffeine even. The more you put in, the more you're supposed to get out of it. So if 5 milligrams in a compounded form gives me a little clarity, then 20 milligrams should give me 4 times the clarity. That's not how this and many other compounds work in the body when it comes to our chemistry. Methylene blue, rather than thinking of it as a single energy input, should be reframed as an efficiency modulator. It interacts with the way that your mitochondria move electrons around to ultimately create energy, and it does this at quite low doses. It's just supporting the machinery that's already there. But a key thing to remember is that your capacity is determined by many factors: gut health, hormones, mitochondrial populations. So if your mitochondrial populations are compromised or low or less efficient for other reasons, then adding more of an efficiency modulator on top of that doesn't necessarily solve the problem that's creating energy roadblocks to begin with. Doing so would be like updating the entire wiring system of your house without having enough energy or power even coming in from the supplier. The wiring improvement happens and is real, but it doesn't necessarily change the supply or the total output in the end. So a deeper question when it comes to dosing strategies isn't always just how much should I take, it's can your system actually use what you're giving it? And this is where, for some people, increasing the dose can actually backfire. This brings us to one of the most important concepts in both pharmacology and one of my favorites in functional medicine that almost nobody in this space is talking about: hormesis. This is a word that's used to describe the body's experience of essentially stress chemistry or body burden of different inputs. Small inputs like small doses of methylene blue can support the system, while larger doses can actually put a little pressure or even the opposite, have detrimental effects on the system. Recent research in 2023 actually confirms this, where researchers gave methylene blue intravenously to both humans and rats, and they were fully expecting to see an increase of brain energy output. More compound, more metabolic activity was the idea, but that's not what happened. Both of the doses they tested actually reduced the blood flow in the brain and the way oxygen was being utilized, which translates to energy production. So this was contrary to the researchers' original hypothesis, more is more. And by the way, I put together a free research summary. If you're one who likes to dive into these articles, I've put it together in the description and the pinned comment below. Feel free to snag that. So when we translate this to real world experience, it often makes sense when someone takes methylene blue at a higher dose and feels worse, maybe more anxious, or like it's taking more exertion to get the same things done, even elevated heart rate and being more agitated in general, the instinct is usually to assume that they need to adjust the dosing and take more, push through it. That's almost always the wrong move in dosing strategies. The hormetic curve means that you've probably moved past the point where the compound is giving it more efficiency benefits to the system, and you've entered the range more where it's creating additional pressure on your metabolism and your energy production. All right, so there is a number here, sort of. Research recently from 2020 looked at what happens when you give methylene blue to mice at different doses and different levels over several weeks. We'll talk more about this in part 4, but at lower doses, the gut microbiome stayed largely intact and the gut-brain, or the cognitive performance, also improved. At higher doses, however, they saw shifts in the microbiome that were significant, and those cognitive gains actually disappeared. The general boundary that keeps showing up in the literature for the upper limit of methylene blue dosing is somewhere around 30 milligrams. This is the oral form, by the way. In theory, below that, microbiome disruption is unlikely, but above it, some of the variables start to come into play for how the gut then influences the brain. Just remember that when it comes to this early emerging research, that threshold is just a signal boundary, not necessarily a hard, fast rule. And you may have to go lower even. It just tells you where a hypothetical risk profile starts to tip the scales into being riskier. It definitely doesn't tell you what the right dose is for your body and your context. Because even that threshold isn't the most important variable when it comes to methylene blue dosing strategies. Here's where this gets really practical if you're wondering about this yourself. Most people interpret their response to methylene blue through our current lens, our current paradigm. If they feel nothing, they assume that the dose is too low. If they feel something negative, they assume that they need to adjust and that it's too high. And if they feel good some days and not other days, they assume that the product itself is inconsistent. All three of these circumstances are treating the response to methylene blue as feedback about the dose itself. But what if the response is actually feedback about your systems, not the methylene blue itself? Another recent study from 2022 illustrates this perfectly. Low-dose methylene blue preserved the mitochondrial enzyme function and its activity, and it prevented memory impairment. Again, this is in rats because we don't have a ton of human research on methylene blue for these usages. But what they found here was that the mechanism itself was not additive. It didn't compound. The methylene blue didn't just create new energy, it preserved the system's existing ability to function. And that's a huge distinction, as with many supplements. But methylene blue can support a system that already has the capacity to respond. But if the capacity isn't there, poor mitochondrial health, poor metabolic function and supplies available, or the overall load on your systems and the cumulative stress burden is too high, that compound can't necessarily override that limitation of the systems. So when it comes to dosing, what does a reasonable approach actually look like? And I want to be clear, this is not a protocol, but a way of thinking. This is general context based on some of the best available research as well as clinical observation. Most people who are using methylene blue orally for cognitive or energy and mitochondrial support are working in a range between 2 and 20 milligrams per day. Some of the most interesting anecdotal reports that I've also seen are from some of my older adult patients who are using it for memory support. And they're using it in small amounts at 2 to 3 milligrams per day on the lower end of that range. The general approach that makes sense for many people is start low and go slow. Pay attention to how you respond and give it some time. If it's not working and you're not feeling the way you think you should feel, perhaps that's time to ask different questions about the systems in addition to wondering about your dosing. Timing matters as well. Methylene blue has a half-life of roughly 5 to 7 hours, and many people find it quite activating. So taking it in the morning is often the most helpful. Taking it before a workout or a heavy exertional period or later in the evening can potentially disrupt heart rate, blood pressure, and even your sleep quality. So be mindful of that. And the cycling question is important as well. Taking breaks is generally a reasonable practice when it comes to this and many other nutritional and longevity supplements. Methylene blue doesn't have a documented tolerance or withdrawal type effect, which is usual, but periodic breaks still make sense when it comes to supplementation broadly. The safest use of something, if there's one thing you can take away, is that this starts with understanding your system. Is it ready for something like methylene blue? Do you have the rest of the inputs dialed in for energy production that are required to make that efficiency tool run it more effectively? And this brings us back to a core point. The dosing confusion around methylene blue isn't always about the number. It's about a thinking and a perspective error. We're asking deeper questions here when it works or when it doesn't. If you're considering this for energy or performance or brain fog, whatever you're experiencing, it opens up a bigger question in this whole conversation. What determines whether or not your mitochondria are actually responding in the first place? This is why the next layer is the mitochondria itself, because before you ask a compound to improve efficiency there, it's important to understand the machinery itself, what strains it, and what it plays a role in terms of human disease and healthy aging. And that's exactly what I go over in this video here. So check it out. I'm Dr. Kenny, Root Cause Health Detective. Thank you for watching, and I'll see you in the next video.